All right, I think we can go ahead and get started, y'all. Yeah, I hope everyone's been having a great time at the Healthcare Now conference this week. We're going to spend a little time chatting about care over cost, which we'll explain a little bit more about in a little bit, but it's a grassroots campaign founded by People's Action. My name is Robel Worku. I use he, him, his pronouns, and I'm the Healthcare for All lead organizer with People's Action. And I'll pass it to Brandon to introduce himself as well. He'll be co-facilitating this.
Yep. My name is Brandon Williford. I'm the Healthcare for All organizer for Citizen Action of Wisconsin. And yeah, we're just going to be going over some good care over cost stuff for you. Just explain what that is.
Sweet. And so before we get into all the nitty-gritty details of the campaign, I'm just curious if folks could give me, whether it's the hand raise emoji or any kind of reaction, if you or someone that you love has ever had to jump through a bunch of hoops or end up with a bunch of debt because of private health insurance. So this could be navigating a maze of phone calls to get clear about answers about your care, if it's not covered or not, or maybe them telling you that they're not going to cover a treatment or a medication that you need, or maybe you thought it was going to be covered, but after the fact, you got slapped with a bill. I'm seeing a couple of folks have experienced this. Well, I know that I have. So a few years ago, I had my health insurance through Kaiser Permanente. And this was maybe back in, I want to say 2018 or so. I had this very weird, random, spontaneous condition where basically there was a leak of spinal fluid from my skull, or a leak of fluid from my skull into my spine. Just nothing really triggers it. It's just a thing that sometimes happens to some people. And what that caused was for my brain to be sagging low in my skull. And what that meant for me was that basically if I wasn't laying flat like this, I was just in, the excruciating pain. I could not do anything for a couple of weeks. So I remember I was just going to the like urgent care and, them telling me it was a migraine with, my uncle's a registered nurse who was sitting right next to me, and he told me this was very much not a migraine. And so there was a bunch of hoops I had to jump through. One, just to get an accurate diagnosis of what I was dealing with. And then second, I was functionally incapacitated. I couldn't work. I couldn't care for myself. I couldn't do anything. And so I was just really desperate to get this resolved. So eventually they figured out what it was. I'm going to butcher the scientific explanation, intracranial hypertension, but basically what I described, that's what it's called. And they had to do 2 epidural procedures. So, basically sticking a giant needle in my back and, pumping some fluid in to basically get the pressure back right in my skull. And so it was only until, several months, I think actually maybe over a year after the fact, that I found out that I was actually carrying debt from those 2 epidural procedures and some other things that were not being covered by Kaiser Permanente. I was, still in my early 20s at the time, was still kind of figuring out what this whole life on your own and figuring out your finances is. And so I remember feeling like a lot of guilt and shame that I had kind of allowed myself to get into this situation. Like they were coming to my door, giving me a court summons over this debt. And it took me several years to pay off that debt to my insurer. And so I know that just millions upon millions of people have similar stories where they're in desperate need of care, whether that's something mundane as a checkup or something as severe as a life-saving treatment. And our private health insurers, these corporate insurers, fundamentally are not here to care for us. It's not the bottom line of why they exist. And so it was not in their self-interest for Kaiser Permanente to dole out the funds to make sure that I was safe and healthy. And so that's the burden that I have to carry. So that's what this campaign is about. Care Over Cost is a national grassroots campaign founded by People's Action to address the problem of health insurers stopping people from getting the treatment they need or refusing to pay for treatments that people have already received. I'm wondering if, I think, was it Fred that I saw whose hand go up earlier? Fred Hackett? I'm curious if you'd be willing to share briefly about the experience you've had with this.
Hi, yes, I'm Fred Hatef. My experience is, it's not my experience, it's, someone in my family who who was diagnosed with cancer and went through a lot of, treatments, and, they're just drowning in debt afterwards, which is pretty much the standard story in America when it comes to the healthcare
Yeah.
system.
Yeah, I appreciate you sharing, Fred. And I know that, like, yeah, it must be overwhelming because someone is fighting for their life, and on top of that, have to deal with, you know, however many thousands of dollars just for, you know, the right to do that. And so, you know, there are a few central goals of the Care Over Cost campaign overall. So one is that we want to win real improvements in people's lives now within the current system. And so there are some stories that we'll share of how we're doing that. But along the process of doing that, we also want to be elevating the stories of harm caused by private insurance companies. Right now, you know, I feel like there's a general narrative that, you know, while private health insurance may be annoying, it's necessary, or at the very least, it is what it is. These institutions exist. This is how we receive our care, and so be it. And so part of what we want to do is elevate those stories and start to shift the public conversation to recognize, actually, maybe private health insurers are an obstacle to receiving the care that we need and not something that's intrinsic or necessary to our lives. Third, we want to build a base of people who have private health insurance and who hate it, right? So we want to build a base of folks who understand that the system doesn't work for them and doesn't work for others and are seeking to change it to a public program. And fourth, we want to stop health insurance companies from giving money to politicians and also stop politicians from taking money from health insurance corporations. One of the large kind of medium to long-term goals of this campaign is really starting to disentangle the relationship between the political class, right, the set of decision makers that pass legislation concerning our health, and separate them from private health insurance corporations who fundamentally don't think it's a human right. So we think that care over cost goes hand in hand with a long-term strategy to win Medicare for all. The deep structural transformation that we, and I think a lot of folks here, are fighting for. A public health program that enshrines healthcare as a human right. But how do we get there, right? We see there being kind of 6 major power pathways that we need to engage in order to reach this vision. So I'll start the second one here, building base at massive scale. Like, we've got to build a large base of people willing to take action to fight for a transformational healthcare system. And I think this means building leaders and teams across the country that are moving towards the same vision. In addition to that, we have to elect majorities at both the state and federal level. We have to change the power dynamics at all levels of government that control how healthcare is managed and dispensed. And so this is part of what we're talking about when we say we want to remove the money of corporate insurers from our political system. Next, we want to build new and unusual alliances. So, like, what are the teams, the cohorts, the kind of set of relationships that we need to be building that best tackle this problem writ large in the long term? And then, like I mentioned earlier, we want to change worldview, right? What are the dominant narratives surrounding healthcare in our country, and how do we shift those things? And have folks understand that corporate insurance does not serve us. And then fundamentally, we want to win policy that builds towards those things. And so the pathway that we've chosen to get at a lot of these things is to divide, diminish, and isolate corporate insurers within our country. And we'll dig into a little bit more how Care Over Cost goes about doing that. So our 10-year milestone is to make Medicare for all the dominant position in the Democratic Party by breaking its relationship with corporate insurers. And how we'd evaluate if we're getting closer to that, what does that mean for us? Is that it means that candidates are starting to run on Medicare for all and win on Medicare for all in Democratic primaries. Democrats are aggressively regulating and limiting the profits of corporate insurers and taking back some privatized public programs and making sure that those are still publicly held. Ensuring that most Democrats don't take money from insurers, but we know that they're accountable to us and not them. And it also means that most Democrats are starting to name corporate insurers as the villain and run against them. It's not enough just to be silent on the issue, but actively naming that corporate insurers are an obstacle to folks receiving the care that they need. And so in line with that, right, we have our big structural transformation of something like a Medicare for all or improved Medicare for all. And we have this long-term goal of disentangling the relationship between corporate insurers and Democrats. So to get along there, we need some stepping stones. And so through Care Over Cost, we want to work on state campaigns that do three things. One is expose corporate insurers' poor care and waste. Second is to claw back and reinvest public dollars in publicly run healthcare programs. And third is to build and retain a bigger base of people who are in support of and actively organizing around a vision for Medicare for all. And this includes with an unusual allies. And so we're building towards this via Care Over Cost. Our primary goal in 2023 is to toxify the brand of corporate insurers by developing a core message across the state to what, like I said earlier, disrupting our public narratives and public power held by health insurance corporations. We want to shift from ideas that, they must exist and they're simply an annoyance in our everyday lives to a deep understanding that they are a primary problem and obstacle to people getting the healthcare that they need. We want to shift public opinion about insurance companies and change people's ideas, narratives, and perspective. And we think that we can accomplish this through base building, right? Actively building up and developing leaders and teams of people that see Medicare for all as our future, and activating those folks through leader-led direct actions and other public tactics against these companies in public spaces in order to overturn claim denials, which we'll get to in a moment. And so before we shift into some of the more nitty-gritty kind of dynamics of the campaign, I'm curious if folks are having any reactions or questions to what I've laid out here in terms of what we see as a strategy to Medicare for all and how Care Over Cost plays into that. And feel free to use, let me track the chat here. Krista Irwin says, this sounds great. Krista, would you like to come off mute for a moment? What's resonating with you in here?
Hey there. Well, I've been telling people, I just heard about this a few days ago when I saw it, that it was part of the conference, this workshop. But I've been talking to people for over a year about how can we do more direct action? How can we cause some chaos and try to help individual people or families in the process of maybe getting a little bit better health care, while simultaneously raising up that this is a really bad issue. It's so bad, we need to go and do something at the insurer's office, maybe demonstrate or get on the evening news if we can. I don't know what tactics you have, but I think, we've been trying for decades and decades now to get Medicare for all or universal health care through the plain legislative system that is just plainly not working. And it's time for something a little more radical.
Yeah, thank you for sharing, Krista. And I really agree. Well, obviously I agree, I'm here leading this workshop, right? But I really do think, I think it can be a valuable effort to kind of reintroduce Medicare for all every year. But I think if we're not being intentional about how we're shifting the political landscape and the conversation around it, I think we're going to keep running into the same wall. And so, yeah, I agree with you. I think it's really time to start taking more fervent public action and really raising tension with the folks that are denying us a human right. Thanks for sharing, Krista.
Yeah.
I think with that being said, I'm gonna, let me track the chat once more here. Yep, just lifting up what Michelle says in the chat. We've got to separate corporate money from funding legislators and healthcare policymaking. Yeah, I think we all understand this, but if you follow the money, you can generally figure out where folks their interests lie. And so as long as corporate insurers are funding our politicians, they don't necessarily have a self-interest in moving something that would disadvantage them. But I'm going to pass it to Brandon here, and we're going to start chatting more specifically about the campaign and claim denials in particular.
Yep. So just going to, so let's talk about some claim denials. So what a claim denial is, a claim denial is when insurance corporations refuse to pay for the care, medication, or treatment that we need and that we deserve for the most part. So And so just to go on with that, insurance corporations put their profits over our care. And they do this by issuing millions of claim denials every year. And then getting a claim denial, denied means we either don't get the care or medication we need, or we get stuck with paying for all of the care as well. So yeah, so with the scale of claim denials, so in 2019, 122 big insurance corporations denied about 17% of all the claims that was submitted. And this is just with ACA plans, because this is the things that we have access to. So this means that insurance corporations denied anywhere between 40.4 million out of 232.8 million in-network claims. And 40.4 million people got stuck with huge bills or didn't get the care and medication they needed. So, and then with that in mind, the Department of Labor estimates that there are over about 200 million denied claims in the employer market every year. And so with this, we're using the Department of Labor estimate because corporate insurers don't have to make their insurance claim denials like that. They don't have to make that information public. And then there are millions upon millions of times every year that these private insurance companies refuse to pay for care that medical professionals say someone needs. So this includes, medicine, tests, specialist visits, surgeries, and other treatments. Sometimes this could be life and death medicine people need, without which they will likely die. So these claim denials are, really huge and impactful for people's lives. And the claim denials can be sometimes even more mundane, like as simple as just getting like $100 bill that takes dozens of hours to get insurance companies to attempt to pay. So,
And we'll pause right here. I see Barbara has their hand up. Do you have a question or a reaction you'd like to share?
Yeah, I'm really glad you're doing this workshop. I'm a retired RN. I'm also something called a SHIP counselor. I help people understand Medicare and Medicaid. And I just want to say to this group, and I'm really reaching out to Krista. Krista, you are absolutely right. It's well past time for direct action. Original Medicare was meant to be for everybody, and the AMA fought it. Now we have another entity fighting it. Not only money to our legislators, but also Wall Street money. Many people are heavily invested in healthcare delivery, which is what I call vulture capitalism. It never should be an investor's way of making money. Healthcare is the #3 sector on Wall Street, the third biggest sector right now. Okay, so Krista's idea of direct action, it could be very simple. Everybody lives near a state building. Everybody lives near a federal building. All we have to do is go there and stay, just like Occupy did, okay? And just share our stories with each other. It doesn't have to be anything fancy. It can just be lots of people going to those two places and staying until they do it for us. And it should be a state and federal commitment. Okay?
Yeah.
We've put in years and years of trying to get this organized, but the number of people that are for it is on our side. So we can do it. Okay? Thank you very much.
Yeah, thank you for sharing, Barbara. And I think something you're speaking to is there's a vast difference between public opinions about Medicare for all and then what happens within legislative sessions. And so I think it's about us building the power necessary to shift some of those dynamics. And I'm appreciating folks engaging in the chat. Yeah, claim denial is a major cause of bankruptcy. When you're stuck with treatments that cost, thousands or hundreds of thousands of dollars, you're simply unable to pay that, and you shouldn't have to just to have saved your life. But I'm going to pass it back to Brandon here to keep moving through some of this information.
Yeah. Yeah. So, sorry. So, So why do the insurance companies issue claim denials? So insurance corporations are only supposed to issue claim denials when the care or medication you request is not covered by your summary of benefits. But sometimes insurance corporations issue claim denials for care that they are supposed to help pay for. The only way to fix this is to go through an intentionally complicated appeals process. Out of the 40.4 million people who received claim denials via ACA plans in 2019, only about 0.2% appealed, and even fewer won. So it's really important to understand that these insurance companies are denying people's claim because of this is directly linked to their profits. They make money when they deny these insurance claims. So we need to, make sure like we put this attention on to this unfair practice. So which companies are putting their profits over your care? Well, this is the list here. So we got Aetna, Anthem Blue Cross Blue Shield, Cigna, MetLife, Humana, ARP, Assurant, Progressive, USA, Kaiser Permanente, United Healthcare. I mean, these are major corporations that I'm sure like almost all of us have been tied to at some point. So it's just important that we identify these people and, show like these are the folks that's actually denying our care. Oh, and if you could put in the chat which company that you are with as well. Sorry about that. All right. Just give me 1 second here. Okay. So the big problem is for-profit private health insurance corporations spend millions every year to keep our elected officials from passing universal health care. They do this so that they can stay in business and make billions of dollars in profits off of our healthcare needs. They charge too much money so people can't afford to pay for the healthcare, and they fail to cover care and medication that our communities need. So they quite literally put their profits over our care. So, sorry. So where does care over cost come in? So through this campaign, we're looking to find community members with active claim denials and organize public fight back campaigns to get folks the care they deserve. And to change the public narrative around corporate insurers. So we do this via outreach, claim denial and appeal support, public campaigning, and direct action. So if you want to keep on going. So with outreach, we do a number of outreach tactics. So this campaign is working as a base builder, regardless of political ideology. People hate getting told no by their insurance companies. Same is true for urban, suburban, rural folks, and although we think Black and brown people experience claim denials at a higher rate, everyone experiences them across racial groups. So claim denials it affects everyone. Is the biggest point there. And because of Medicare and Medicaid privatization in most states, poor people experience them as well as more middle class people as well. So it's affecting poor folks and every group, regardless of political ideology or where you may live in this world. So it's just a huge impact upon a huge section of the working class. So we're reaching out to folks all across the country, from Maine and New Hampshire, New York and Connecticut, Maryland and West Virginia, Indiana, Illinois, Michigan, and from my home state, Wisconsin, as well as Iowa, Missouri, and out in Colorado as well, to really build this base and show folks that these claim denials are real and have folks share their stories. So we've been reaching out to people and meeting people where they're at by knocking at their doors doing street canvassing. So finding people at locations like bus stops, grocery stores, health clinics, and pharmacies, and having conversations with them there. We also been tabling at community events, especially during the summer. And we're beginning to experiment with doing digital outreach as well. So we also invite folks, we also invite folks by holding absorption events like appeals teach-ins, so we can explain the appeals process to folks and give them the information they need to fight back against their insurance companies. So what do we do then? So so we support folks with the process with our national appeals team. We've built a team of volunteers who are experts on contracts and insurance, who have had to fight insurance companies for themselves and their families to help people file appeals and complaint letters to regulators. And sometimes this isn't enough. Like with Terry, sometimes it is enough, sorry. So like with Terry in Wisconsin, who had received a bogus $100 charge of removal for some hardware that he had in his hip. We was able to follow this appeals process, and he was able to get, we was able to push him through that that claim denial. Or Rakisha in Michigan, who had to fight with her insurance companies to get her mother life-saving medication following her heart surgery. So, but a lot of times this isn't enough. Oh, sorry. So we got Rakisha here. We have her story here, so we can share that as well.
Just to check when I shifted, can folks still see my screen right now? Okay.
We can't hear the video.
My mom had triple bypass surgery. So she had it in Chicago, Illinois, because the state of Michigan would not touch her. So she transferred from Michigan from Illinois to Michigan. When she came back home, the Chicago doctors told her to do a follow-up with her primary doctor. When she goes see her primary doctor said, you know, everything looked good, but I think you need to go back to Chicago about your pain. So my mom, like, you know, I'm here, you my primary doctor, I'm telling you all my illness, you know all my illness, and I need pain medicine. From March, she go back to Chicago. When she go back to Chicago, they said, well, it's nothing we can do. You got to go back to Chicago, back to Michigan to see your primary doctor to get the care you need. This is April and May. She's dealing with severe pain. She's surviving it, but she's dealing with pain. No follow-up from her primary doctor, no insurance company doing follow-up because she was following them also, no help at all. May of 2022, I was on a call with Michigan United. They was talking about cost for care. And because I'm a care provider and because I want to get the help that my mom needs, I said, hey, I got a question. I need help and I need you guys to help me to get the help to help my mom, because one, she can't get her medication due to the fact she's in pain and she have not even seen a pain medicine doctor, because she wasn't asking her doctor to just get her pain medicine. She was asking her doctor to let her go to the pain specialist doctor to see what's going on. Because if you don't know what's going on, how can you say that she has any pain at all? So me going to a Michigan United meeting about cost for care, I asked the question. He said, "Do your mom have an advocate?" I said, "No, she don't have an advocate. Just me and people, family. It's family members. We work together and try to find out what we try to do." She gave me direction. She said, "Look, call the back of your insurance card. When she called the back of the insurance card, let them know, hey, you need an advocate, and your mom just had open heart surgery. Medicaid, we need you to do your job, and Blue Cross Blue Shield, we need you to do your job." So all I need them to do is stop playing the game with me and give me the answers to help my mom, so she won't have no extra stress. Because when you don't have no pain medicine, or you going through all this loophole just to try to talk to somebody, that's causing my mother stress. I'm not trying to lose my mother. I just want people to just do her right, and not just her, many of Detroit seniors do them right. Me being at that meeting saved my mother's life, because each step they told me to do, call the back of the car, ask for an advocate, go in her medical chart saying that she's in severe pain and she has to see someone, and somebody would recognize that somebody would give her answer. And sure enough, they gave her answer. And today, my mom is on pain medicine. It ain't the best, but it's something to help her pain, to ease her pain, because she said, "I've never lived every day in pain." And my mom has other illness. So just for that alone, saved my mother's life, or just coming to a meeting. Because all I felt like is I was hopeless. I want to be able to save my mom, what I'm going to do, how I'm going to do this, and how I'm going to keep my mom calm, because some days her anxiety be so up that it was just hard to keep her even calm. And my mom is a strong woman. I just have the strength to just tell this story to save so many other families in the city of Detroit that's going through this, that don't have no answer. So now I tell them, like, hey, call the back of your car. Hey, put on in your chart that you're going through this, because I learned something, and now I'm sharing it with other people to make sure that their family do not suffer like my family suffered.
Oh, Brandon, I think you might be on mute.
Happens. So yeah, I was saying that Rakisha's story is very touching, and it shows what happens when folks are able to actually go through the appeals process and things work out. But a lot of times it isn't enough. The insurance companies is the judge and jury in the appeals process, and they have a vested interest in not dispensing care because it trades off with their profits. So that's why that's when we bring the fight to them, because we organize people together to fight back, both to get the individual care that they need and to highlight the ways private insurance fails to provide the care we need and undermine their hold on the healthcare system. Sorry. So we engage in public pressure campaigns because we found that corporate insurers care more about their public image than they do about providing care for their members. So we collect online petition signatures for folks, individual cases, and send those letters to CEOs and other pertinent decision makers in the community. Members' cases and sometimes, in community, And sometimes this wins out and saves lives, like Carly in Pennsylvania.
I'm very, very relieved. The whole process has been painful and really scary for me. When I was dealing with my insurance by myself, I was told different things each time I called. And because of this, I had zero understanding of what was happening or how to move forward to get my surgery. We have in writing now approval for the surgery, which means I can move forward in planning a long trip and a notoriously long and painful recovery. It means that there is a possibility that after I recover from my surgery, I will be able to get my other medical issues under control and hopefully beat that 62.1% chance that I will die in the next 5 years. It means that I can have some more hope. I have a very rare disease called neurogenic median arcuate ligament syndrome, which causes end-stage pancreatic cancer-like pain and an inability to eat or drink, among other symptoms. This disease resulted in me having several different kinds of artificial nutrition, including TPN, which is nutrition to your veins. This led to 2 life-threatening infections, which in combo with my medical circumstances leaves me with a 62.1% chance of dying in the next 5 years. When I first started working with Care Over Costs and the National Appeals team, I was facing more than $17,000 in medical debt as a result of United Healthcare denying coverage of the bills from my appointments for this disease. I was also facing the strong possibility that I would never be able to get the surgery needed to treat the disease, which is estimated to be more than $50,000. This would leave me in circumstances that would never allow me to recover or be free of pain, and with little way of increasing my chances of survival. My primary health insurance is a United Healthcare Medicare Advantage special needs plan. I switched to this insurance from original Medicare because of the additional benefits that they offer. I was going with many critical unmet needs, and the benefits provided with this plan met many of them. Some of the examples of these include free transportation to medical appointments, a monthly stipend to use public utilities, including electric and Wi-Fi, a free gym benefit, which allowed me to keep taking my arthritis classes at the YMCA, a monthly stipend for over-the-counter medical items, which was really important for me because with my autoimmune disorders, my doctors prescribe special supplements, and the insurance generally doesn't cover them or charges a large copay because they're available over the counter. The whole point of Advantage plans is to provide benefits that would be considered extra, and that's why they're like an advantage. In that case, that makes sense to switch. However, a lot of the things that they consider extra are real and sometimes critical needs that I need to be like meeting. For example, anything a doctor prescribes that is, FDA approved, has the research, should be covered. There shouldn't be a need for an over-the-counter benefit because most of the time, if your doctor is recommending it, that means you need it. So, like, for example, without vitamin D, my levels could get critically low because I have lupus. It's a necessary item that I have to take, and it should be covered. The cost of transportation to my faraway medical appointments has caused me debt. Getting help with transportation to get to the doctors who are keeping me alive is a necessity. There are some benefits that are easier to argue against than others, but like these, some are absolutely necessary for medical, physical, mental health, and well-being. I should not go broke for keeping my body and brain alive and healthy. Keeping myself alive and healthy is my human right. And if you're watching this, it's also your human right. One of the United States Senators, Bob Casey, his office reached out to United Healthcare on my behalf in order for us to push things through and get the surgery covered. It was a combination of him and everything that we've been doing together with Care Over Costs. That's what got me the approval for my surgery. I am incredibly grateful to each person who worked on this with me and to each person who signed my petition. You're changing and really saving my life, and it should have never had to take this much for me to get necessary medical care. The system is broken. And there are hundreds and thousands of Americans who don't get the medical care they need because of this really, really screwed up system. Selfish capitalism reigns while genuine and hardworking diabetics can't afford their insulin. That's not even rare. It's not a rare disease or treatment. It makes me sick to my stomach that anybody is profiting off of me being sick, to me being in pain, to me suffering. It is my human right to be healthy and safe and alive. And I deserve whatever treatment that I need without any kind of significant personal cost, whether that be financially, physically, or mentally. United Healthcare makes $20.1 billion in profit every year. And their system is set up in a way that makes people like me who really need medical care, it makes it impossible for us to get it. And if I didn't fight back, and for a lot of other people, if they didn't fight back, they would not get the care they need. They would suffer, they might even die. And it makes me really, really sick to my stomach that it's set up this way. I don't think anybody should be profiting off of anybody's health issues, and especially a company who makes a million times over what people like me make and can afford to provide us the care that we need. Getting your care denied by a private insurance company is an issue that impacts everyone. People are fighting back in the Bronx and in Western Pennsylvania, where I live, to Pueblo, Colorado. So join us at www.careovercost.org.
So yeah, with that, okay, I just want to make sure I was not there. Sorry. So Carly's story is a testament to show what happens when online pressure campaigns work. But there's also a lot of instances where online pressure doesn't work either, which is when we need to escalate to direct action. Like with Erin in Illinois, she was fighting $1,000 charge from her insurance company, and they charged for her for it, despite her checking in beforehand to make sure it was covered. They've been giving her the runaround for months, even after she filed an appeal. So when we pulled up to their headquarters and let them know that we were going to fight back, they capitulated and canceled out the bogus charge. Or with Mark in Missouri, Mark was on a treatment plan for a long-standing fight with ulcerative colitis. Sorry, I have a hard time pronouncing that word. My apologies. And hadn't had an issue for over a decade, until his insurers decided to move him onto a less effective drug to save themselves some money. Despite being on a higher dose of the new drug, Mark almost immediately started experiencing symptoms again, and his quality of life began to erode. And his doctors confirmed that even if he were to switch back to his previous treatment, it would no longer be effective. And so we did an action at their local headquarters to show that fellow Missourians weren't going to let them get away with this. And we were still working with, and we are still working with Mark on this case. So, sorry. And in November of last year, we went straight to the headquarters of Elevance, which is the rebranded version of Anthem Blue Cross and Blue Shields. And the huge profit-making Anthem Blue Cross and Blue Shield, I should add, in Indianapolis, Indiana. We took over their lobby and had Anthem and Blue Cross Blue Shield members share their stories of being denied care and the impact that it had upon them. And we shared demands around overturning any appeals that we submit, to stop denying care recommended by medical professionals, to be completely transparent about the scale of their denials, and to provide data breakdowns based on state, geography, race, and gender, as well as the monetary value of those denials, and to rectify any discrimination immediately. Also to hold monthly open mic meetings with their members and to acknowledge that they cannot be responsible for both denying claims and running appeals process and requesting public authorities to take over that appeals process. Yeah, so this is another slide for Fairfield, Indiana. Yeah, here's a video. I'm not sure if there's any sound on this.
Apologies for the lack of sound there, but yeah, like Brandon spoke to, essentially we took over their lobby, had both inside and when we were later ushered outside by the police, had members with Anthem and Blue Cross Blue Shield publicly share their stories about the care that they'd been denied, and we were demanding that those cases be overturned. It also delivered a letter of those demands to their CEO, the CEO of Elevance that day as well. And yeah, Linda, who's in the chat here, was actually a member with Jane Addams Senior Caucus, one of the organizations working on this campaign out in Illinois. So yeah, thanks, Linda. I'll give it back to you.
Thank you.
I'll pop in here if I can figure out how to make this work. And so yeah, I just wanted to show this. But yeah, so I mean, a lot of folks earlier in the workshop were speaking to the necessity of engaging in direct action, which yeah, you came to the right place. This is a tactic that we use to really raise tension with our targets, with these corporate insurers, but also start to shift the public narrative about what is needed in our healthcare system. And it really boils down to this question that's on this sign here. Who are they to decide if we live or die? We have a treatment that's being recommended by our medical professional. An insurance company should not be the institution that's getting in the way of that care. And so, yeah, I know that some questions have popped up in the chat, so we'll pause in a little bit to take those. But in terms, I wanted to share some opportunities to get involved with the campaign. One of which is to actually support one of the cases, an active case that we're working on right now with one of our organizations, Rights and Democracy New Hampshire. Hopefully my audio is working this time because I'd like to see, I'd like to have Jen, who is the community member going through this, speak to her case herself. Please let me know if the volume isn't working. And then as we have the content warning here, this piece does discuss suicide and suicidal ideation. And so I want to give that advanced warning for folks before we start the video in case anyone wants to step away or mute for a little bit when that's referenced. But please let me know if the audio is coming through.
Hi, my name is Jennifer Coffey and I'm from Manchester, New Hampshire. I have spent years of my life working in healthcare. I was an EMT and an LNA, and about 20 years of my life was spent either in an ambulance or in an emergency department taking care of people. And in 2013, I found myself on the other side of this with breast cancer. And unfortunately, that breast cancer turned into some rare diseases that I didn't even know existed, and I was a healthcare worker. I have what's called CRPS, complex regional pain syndrome. And I also have small fiber neuropathy. But CRPS is also known as the suicide disease. And I share this with you because it's really weird to be on this side of it now. When I was working in medicine, I never imagined not treating a patient. But now, being on this side of it, I find that I can't access the same healthcare that I work to get. There are treatments and things that can be done, but they're held away from me through denial by United Healthcare, not allowing me to have access to treatment, to the point where I suffered so incredibly that I was in the hospital all the time, every month. I was given so many medications. I couldn't think straight. I couldn't remember things. I would go through horrific treatments where they would shove these needles into places in my body to try and deaden the pain. And you can hear me scream in the waiting room. And it wasn't done in the least amount of suffering. It was suffering. You suffer just to try and get out of just a pinch of the pain. I ended up selling everything I owned. I lost my career when the cancer hit and I couldn't get better. And the small fiber neuropathy has caused my body to destroy all of the small fibers that live in your epidermis. And I've barely got detectably 1% or actually less thereof in my dermis. My body is attacking itself. And it's not my fault. I got breast cancer. But when I need treatment, like my ketamine infusions or low-dose naproxone that have helped me immensely, United Healthcare said, no, we won't pay. And they haven't. In all these years, the only reason I sit here today is because I have kept myself alive through borrowing, through selling, through doing whatever I could to get the money that was needed in order to buy the treatment to keep me alive. It's literally that. If I don't buy the treatment, I die. I'm not going to. United Healthcare just red stamps everything that comes to me, so it's all on me. And I don't think it's right that I pay to have healthcare, that I worked in healthcare, that I did everything right, and I never asked to get cancer. And now, and when I need it, it's denied to me by United Healthcare. It's time that these Medicare Advantage plans actually did the right thing and provided the treatment that I'm entitled to. I paid in for this. I paid for this insurance. And I helped administer the care for other people who paid insurance. It's me or no, nothing. No money, no drugs. No money, no treatment. No money, no life. And I might as well have no insurance because United Healthcare's Medicare Advantage program denies me more than it'll ever approve. When I was a Republican state representative, I supported ideas like uniting insurance policies across state lines, trying to make it easier for people to get health care, that we had to have a better way. But I was wrong. And I realize now, unfortunately, in part because of my own situation, I'll admit it, that universal health care is the only way that everybody's life is going to matter. Because as it is right now, your life only matters for as long as you can pay the bill. Please do us all the great need that we have. Please help us by sharing this information, tagging it with United Healthcare, sign the petitions that are out there to help, and send a message to the CEO of United Healthcare and let them know that we are going to hold you responsible. There are thousands of people like me out there that have suicide disease that are going to die or are going to commit suicide because they can't access treatment. They can't access care because United Healthcare and organizations like them that supply these so-called Medicare Advantage plans is not covering the life-saving treatment that people with the rare disease I have. And there are people in this nation, thousands of us, and some of them children. Please share, sign, and help. It's time that everybody had access to health care, no matter what their station in life.
So yeah, one of the ways, as Jen spoke to her situation with complex regional pain syndrome, one of the ways that folks can support the campaign right now is by supporting Jen, which is like I mentioned, she lives in New Hampshire and is working with one of our organizations, Rights and Democracy New Hampshire, to get United Healthcare to cover the treatment that she needs. And so I'd like to take 1 minute here, if folks could pop open a browser or on your phone or wherever makes sense. I'll drop the link to this in the chat as well, but it is ppls.ac/GenCare, GenNCare. If you put that into your browser, it'll take you to a petition that you can sign, which will be a letter that's being sent to letters that are being sent to the CEO of United Healthcare and a few other pertinent decision makers in Jen's case. So I'll leave a moment for that.
Can I say something really quick?
Very quickly, yes. Who's that speaking? I can't quite see you.
It's
Oh, hey, Laura.
from
Hey, Laura.
Democracy.
Yeah, go ahead.
She's a very good person, and I've been working with her, with Heather, and I've been getting her information to try to at least get her medications without having to pay for them right now. Right now, United Healthcare is refusing to take the amount of money she's put into Medicare as her deductible costs. She has to start all over with United Healthcare because she's been using GoodRx to get at least something that she can get. So we are now asking Jen to get a history of every single dime she's put into GoodRx in her doctor's appointments and stuff that United Healthcare has refused to pay. And I will be making a few phone calls this week once she gets that information for me. So we are fighting this, and we're going to fight as hard as we can, and we're going to make sure that she gets the care that she deserves. I just wanted to let you know that.
Yeah, thanks so much, Laura. And for folks that didn't catch it up at the top, Laura is a member and a leader with Rights and Democracy New Hampshire, the organization that's working with Jen on her case up there. So yeah, thanks so much for sharing that, Laura, and for being here today.
You're welcome.
Another way that folks can get involved is to share your story with us. If you or someone you love has, whether it's an active claim denial, which we'd love to support in a fight back campaign around, or just something that's happened in the past, like we want to be able to collect as many stories as possible so we can share these and really shift the public narrative around the role of private insurers in our country. And so, folks, if you do have a short story you'd like to share, feel free to visit careovercost.org. And I think right when you get to the site, it should prompt you to share a story on our survey form. And then the third way to get involved, if you'd like to join our supporters list, we're building out a supporters list, so whenever we have pertinent action steps or bigger events, we'll email this list to let folks know updates about major cases and other things that are going on. Email me, and I will get you added to it. So my email address, so Robel Worku, r.worku@peoplesaction.org. I'll also drop that in the chat so it's easy to copy and paste wherever you might. But if you email me, I'll get you added to our supporters list, and you'll get routine updates about the campaign and how folks can get involved with folks' cases and the campaign writ large. And with that being said, I think that's all we have as far as content for today's workshop. And so I want to leave some time here for any overall reactions and questions to some of the things that we've discussed today. I think I saw a couple pop up in the chat, but folks might have to remind me here, or either repost them or just come off mute and share. But yeah, feel free to drop in a hand raise or anything like that if you'd like to share for a moment. Yes, okay, thank you, Heather. Media strategy. Yeah, so we do have a communications plan and are engaging with media around in a litany of ways, really. So one of the things that we started doing is when particularly Elevance, but I think maybe some other insurance companies as well, when they do their quarterly earnings reports, we're rebranding them as Stealings reports. And so we'll be doing press releases through our local organizations. And as they're literally doing their events, when they're kind of speaking to their shareholders, we'll also be kind of posting alongside and really displaying the litany of ways that they're denying care in order to receive profit, like when they're celebrating making billions of dollars. That's really coming off of our backs. We also have individual media strategies when it comes to the direct actions that we do, so doing press outreach. Folks have been investigating strategies around doing like letters to the editor and engaging with newspapers in different ways. I know I think there was a big report from ProPublica on the status of like routine claims denials, and we've been engaging with some journalists and reporters on the quest, like national journalists and reporters on the question as well. And so, yeah, we're working to build more relationships with media and press, and are especially using that when it comes time for us to take action. So yeah, thanks for the question, Heather. I see Linda. Hey, Linda, you want to come off mute and share?
Yeah. Carly mentioned her senator as
Mhm.
being very helpful. And at our teach-ins that we're giving, people ask, is it worthwhile contacting our senators, our representatives about this issue? We're lucky in Chicago that all our representatives are for Medicare for all, at least. But I wonder sometimes, are they aware of what's, the care over cost and the actual costs to people, to real people that have to go bankrupt or have to use their own money or whatever. And we usually say, yes, please do contact your representatives and senators. And is that something that People's Action is also working on, it like in DC, among Congress and the Senate, and also Health and Human Services, of course.
Yeah, thanks for the question, Linda. And just to flag for folks, Linda's with a leader with Jane Addams Senior Caucus, which is an organization based in Chicago that's involved in the Care Over Cost campaign. So they've been doing different forms of outreach and events to really let folks know about appeals, how they can file them, and how to support and wage some of these public fight back campaigns. In terms of relationships with legislators, we're I think still building out what that could look like for next year in terms of if there's state level legislation and other possible federal moves to be making. In terms of folks' particular cases, I do think that reaching out to representatives can be helpful. And having them kind of offer support or reach out to a particular insurance company. I think it's more effective when the ask is coming from a group of us that are organizing together to get a public official to take action than when an individual is, which is really kind of one campaign is that it's really hard, really scary to go up against a multi-billion-dollar corporation by yourself. And so we are really encouraging folks to, come within our organizations, organize together, and that's where we can make those asks of public officials. And then Aisha in the chat, who also works with us at People's Action, is mentioning that, we're also talking with Senate staff in Congress on the Health, Education, Labor, and Pension Committee about arranging a hearing on insurance denials for later this year. So we're hoping to do something that is public and congressional to really highlight the ways in which they're not dispensing care and getting them to be more transparent about the scale of the issue.
Great. That's Senator Sanders' committee, right?
Yes, ma'am. That is,
Okay.
Senator, the chair of that committee. And so we're speaking with some of the Senate staff around arranging a hearing later this year.
Great. That would be wonderful.
Hey, yeah, tell them, Mark, name and shame.
Thank you.
Yeah, for sure. Thank you, Linda. Good to see you again. Curious if folks have other reactions or questions or comments they'd like to come off mute and share. Bob, yeah, go ahead.
Yeah, I have a question in terms of trying to track how the political money is going into these things. It's easy to find out campaign contributions to a candidate, but what about all the dark money, all the PAC, the super PAC, the money that's funneled through the DCCC or wherever else going into candidates? That's a lot harder to figure out because you see people voting against certain things, our politicians, and there's not a clear sign that they're getting direct money, but we know they are through these other means. So do you have a way of helping us track the dark money?
That's a good question. And I'll be honest, not one I have a great answer to, because I think you're right. There is very easy to find campaign contributions. I think, if you've been organizing for a bit, you eventually get trained on that stuff and it's not too difficult. In terms of tracking dark money and how that's influencing folks' decisions, I don't have the clearest sense on that. Yeah, no. Yeah, definitely something worth considering, or at least figuring out which institutions are engaging in things like that and some other strategies for tracking that. Because that's a great point, Bob. All right, well, absent any other comments or questions, I think I might go ahead and close this out here today. And give folks 10 minutes back before you're hopping into other workshops and such. But again, if you want to join that supporters list, we'll be sharing more updates about folks' cases and other ways to get involved with the campaign. Please email me at r.worku@peoplesaction.org. I'll drop it in the chat once more just in case. And I'll get you added to that list moving forward. But I appreciate y'all hanging out with me and Brandon for a little bit and really engaging with the workshop and the work that we're doing on this campaign. And I hope everyone has a lovely weekend.
Bye.
Bye, y'all.